Welcome everybody online. Good to see such a good group here. So welcome. This is this is the webinar on language in the prevention of sexual exploitation and abuse, PSEA. My name is Alexandra, and I'm joined by my colleague Mariska from IOM's dedicated team on interagency PSEA support. This is the third webinar that has been organized between Translators Without Borders and IOM on PSEA and language. These webinars come from the work that our team does when we are working with country colleagues and receiving interest and good practice from colleagues working on PSEA in country to make our PSEA work more accessible, more clear for all stakeholders involved. And we know this is a topic that has increasing interest from those who are working in PSEA, and we anticipate each webinar an increasingly diverse audience for each event. And so for this topic, we are very fortunate to have the expertise of colleagues from Translators Without Borders. TWB is a US registered nonprofit that works to overcome language barriers to knowledge. So really the best people to have for this topic. Some housekeeping. Whoever is running the slides, we could go to the next slide. So a reminder, thanks to everybody who already has their mics on mute. That's very helpful to minimize the background noise. We will be hard and mute if necessary, if sounds come in, so that those who receive the recording after the webinar can hear everything clearly. Please do put any and all questions that you have in the chat. Use that function. Can see that people are already typing in the chat. There are colleagues from TWB and Mariska and I from IOM that will be supporting the chat function throughout the webinar and responding to the chat in real time, as well as capturing questions for after the presentation. There will be time to go further into topics. So the session is being recorded right now so that colleagues who couldn't make it today will have a chance to hear. And that recording, the presentation, and a synopsis of the key questions and responses from the chat will be shared with everybody who registered for this webinar, and the ISC results group on accountability and inclusion has kindly offered to share the recording after as well. So with no further ado, very happy to introduce our main presenter, Alice Castillejo, Program Advisor. She is our main presenter and is supported with TWB colleagues who will be monitoring the chat function, Alyssa, Alex, and Zainab. Whoever is not muted, could you please mute? Thank you very much. Thank you. Alice, our speaker today, works with TWB's Global Crisis Response Team, which supports humanitarian organizations to communicate more effectively with the people they seek to serve. She's worked in development and humanitarian sectors for the last 28 years in governance, education, health, and advocacy. Her experience includes some 11 years in Pakistan, Cambodia, South Sudan, and Myanmar. And she joined Translators Without Borders in 2017 and now leads TWB's work on PSEA and in the education sector. So welcome very warmly to Alice, who will take us forward with the webinar.
Thank you very much, Alex. I hope you can all hear me fine, and thank you for the introduction. Okay, I am going to stop my video so that you can all look at the slides and so that we can follow carefully on the screen. And I'd like to first of all thank you all very much for joining. I hope this is going to be an interesting and useful presentation. I'm going to start by briefly reintroducing ourselves to some extent. Since our foundation, we have been Translators Without Borders, and our work has been very much involved in supporting people, supporting humanitarian and development partners in very practical work around making sure that people had access to information in the language that they needed. But over the last 5 years, we really feel we've outgrown our name. Translators Without Borders remains the name of our largest team and the core of our operation, which is our 60,000 plus linguists and translators who allow us to provide the whole range of language services to other organizations. But we have also now developed our Clear Tech team and our Clear Insight team as the divisions respectively who are working on innovation and technology and research and evidence building. Today, we're going to be pulling in a lot of our presentation from the work of the research team, Clear Insights, and our international programs teams, so that together, learning from our field experience and from our research, we can focus on language in PSEA and what the challenges are, and hopefully how we can address them. Okay. So first of all, just to begin a little bit by talking about some of the issues and some of the challenges. So as sectors, the humanitarian and development partners are generally used to looking at factors such as poverty and gender and age and disability as being major drivers of vulnerability. But language and vulnerability are profoundly interconnected. Speakers of marginalized languages often experience multiple layers of disadvantage, problems accessing education and healthcare, human rights, their representation, technology, certainly. And each driver of vulnerability compounds the next. So in societies, many women may get less access to education and fewer chances to learn other languages, and therefore less access to technology or representation, for example. The world over, poor educational provision for disabled people limits their options to access communication, and poverty translates into low literacy and less access to the languages of wealth and power. So putting all of those factors together, an impoverished woman with disabilities who's a speaker of a marginalized language would be likely to be the last person to get to know how to report sexual abuse and exploitation, or how to access the services if she needed them. So that means that the marginalized language speakers can be some of the people that development and humanitarian actors need to reach to prevent SEA, but they can also be some of the most difficult to reach. To meet the CHS standards, our service provision needs to be impartial and relevant and based on participation and feedback, making sure it avoids negative effects. If humanitarian responders can't fully communicate with marginalized speakers of marginalized languages, they can't possibly really be impartial because they're neglecting to identify the needs of those groups, and they might not be able to provide services to them, or probably to be able to get their feedback and their participation. Indeed, if you neglect the marginalized groups, marginalized language groups, what might happen is that we may be exacerbating existing ethnic tensions or reinforcing traditional patterns of exclusion. So failing to tackle language can certainly exacerbate vulnerability and inhibit reporting and service provision to survivors of SEA. We know from the CHS Alliance Humanitarian Accountability Report from last year that the lowest scoring commitment is commitment 5, which states that complaints should be welcomed and addressed. This is a very serious concern because it shows that we're still facing a challenge about how we listen to feedback and how we take the concerns and complaints of people that we're supporting. And critically, it shows that there are still some systemic weaknesses. We believe that language is very fundamentally a part of that. So we're going to spend a little bit of time looking at what goes wrong to understand what we're failing to do and then how we might be able to address it. So we're going to start with a brief overview of the current typical approach to language in development and humanitarian programming and some of its limitations. Despite our commitments to be inclusive and accountable, we often don't know what percentage of the people we're trying to support need additional language support, for example, to understand their rights or to report sexual abuse. And without that data, it becomes very hard to earmark resources for language. We also assume that local staff and partners are going to be able to provide language support for us, but do so without us resourcing it. And nor do we address their language needs by understanding in what languages they might need to explain PSEA concepts for their colleagues. So the lack of language data and resources for language prevents our attention to language in our PSEA communication strategy and our localization agenda, and prevents us working towards proper multilingual reporting and investigation. We struggle to give attention to the nuances of the language that we work in, and we hope that concepts that we're talking about can be transferred and easily understood in both directions, but we do risk a failure of communication in making that assumption. Finally, obviously, if we don't include language in our monitoring processes, we're not going to be able to track to the extent to which some groups speaking particular language might be underreporting, for example, and therefore we won't be able to address their particular communication needs. The map here shows language diversity around the world, and the darker the country, the more linguistically diverse its population is. In 2021, it's estimated that 235 million people are going to need humanitarian assistance. And for many, if not most of them, their needs are going to be almost invisible to us because of the languages that they speak. On average, people speak 47 languages in each country around the world, and most of those languages are marginalized. In general, the humanitarian community operates mostly in English, to some extent in French and Arabic and Spanish. And we have not traditionally been very aware of language as a factor of our reach and effectiveness, and in particular, our accountability of our programs. Development actors have generally got more time to build up their language understanding, but often still remain unaware of the scale of a hidden language diversity in the communities that they serve. So while I can show you a broad map of language diversity like this, what I can't show you is, in particular, in each country, how many people speak what language and how they are dispersed. We only know what languages we need to communicate in if we gather the information and share it, and that's not routinely happening. And the result of that lack of data means that we're less language aware. We've got a bit of a chicken and egg situation where the less data we have on language, the less we're aware of the issue. And the less we're aware of the issue, the less effort we make to collect data on language. So if there's just one thing we're going to ask you to take away from the presentation, is to advocate for routine collection of language data in needs assessments, all types of needs assessments, and that information becomes routinely shared, so that over time we have a much better collective understanding of the language map of the world, and that when programming begins, people are able to immediately address the communication needs in respect to language. So the lack of data can't be overcome only by asking our local partners and staff. They're certainly going to have some very good insights, but we need to recognize that they might have come from a better educated and probably majority language groups, and that they haven't got any more access to data than anyone else, and also that their personal experiences might not have enabled them to understand the language challenges of more marginalized groups. And I'm going to take an example from the Rohingya community because we spent a very long time working there. So the figures on this slide are showing us the results of a survey of more than 170 international and local humanitarian staff and more than 600 people from the Rohingya community, both in Myanmar and in Cox's Bazar. The biggest communication problem was an assumption by development and humanitarian actors that Chittagonian, Rakhine and Myanmar languages, which are spoken in Cox's Bazar and the Rakhine region of Myanmar, were well understood by the Rohingya community. And largely the international staff depended on local colleagues to explain to them what the language needs were. But as you can see from the data, the majority of beliefs were flawed. If you can imagine a crisis that affects where you're living now, the town or location where you are, and that tomorrow, without any access to the internet, you are going to be asked to estimate the number of speakers of different languages and their locations, I wonder if you could do it. And that is what we're often expecting of local partners and staff. And I know that I certainly couldn't do it for where I live. So there are solutions to this problem. In the cyclone responses in Mozambique in 2019, for example, aid organizations typically attempted to communicate with affected people in Portuguese. But as this map shows, in the province most affected by Cyclone Kenneth, just 1 in 5 women understood Portuguese, and even fewer can read and write. As part of our work in the cyclone response, we took the existing data that was already available and mapped the languages of the most affected provinces, and then conducted an assessment on people's language and communication preferences. Now, this helped the responders know which languages and formats to use, and the result of that was that WFP was able to scale up its hotline from a single agency line to a multilingual and interagency complaints and feedback mechanism. And the call center agents on that line represented 12 out of the 14 of the country's most spoken languages. And what was interesting is that feedback from women in the affected communities who had identified that there was a fear of not being understood when they called the helpline were also given additional information about it using audio channels and graphic communication. So where there are agencies who can collaborate together on language data, and this is one example, but we've also done lots of work, for example, with REACH and with other accountability-focused organizations, IOM's DTM team, and more recently using the multi-sector needs assessments, where then we can see how much richer the data becomes and how much more precise the communication strategies can be. So this can make a huge difference to making a really successful reporting mechanism and understanding which groups might be marginalized in reporting SEA. So we know that there are risks around collecting language data. The main concern about gathering and sharing the language data are mostly related to the risks where language and ethnicity are linked and where there might be a potential backlash against people from having gathered their ethnicity, having understood their ethnicity. And this is mostly seen in issues where the language people speak is taken as an indicator in some conflict situation or in a refugee situation. So in every case, we know we have to balance the risks of collecting and sharing that information with the risks of not using it. So each case has to be taken case by case to make a sensible solution. And protection specialists, in situations where we know that there's going to be a risk to people, obviously we need to involve protection specialists in understanding how to gather the data and in making sure that it's shared in the right way. We've done a lot of language data mapping, and the key principle is around collecting household level data, but only sharing aggregated data in the analysis at a level of detail that organizations need to plan their communication. For example, in Northeast Nigeria, that would have been sort of campsite level, while in Mozambique, that was at province level. In data management are really key to this. And of course, having the advice of the protection specialists. And at the end of the presentation, we're going to put up a slide of resources, which will include lots of really simple guidance on the safe management of this kind of data. The next issue is around our support for and dependence on local partners and local staff and organizations. And we're going to look particularly at planning and resourcing. As I mentioned earlier, we rely heavily in general on untrained and unsupported national colleagues to manage multilingual communication, translation, and interpretation. We often don't really budget for professional language support, and nor do we cost up what resources our local colleagues and our local partners are going to need to build up their own translation and interpretation skills. In development and humanitarian organizations, we tend to believe that local staff and local enumerators and local partners will meet language needs at no cost. But without information on the languages spoken by the people that we're trying to work with, the communities that we're trying to work with, we actually don't know if our colleagues have the right language combinations to communicate with them effectively. And it can be really hard for staff who need work to admit that they might be struggling to communicate. There's also a tendency to add translation and interpretation into national colleagues and partners' workloads without factoring in the additional time that takes. and the need to support them with the training and the resources to do it successfully. It doesn't just happen, it can't just be a bolt-on. And the costs of truly multilingual communication strategy and reporting might include the time necessary to find new partners or recruit dedicated staff. And again, that's quite rarely factored in. We have recently done some very interesting research with the education sector, the global education cluster, and I'm going to use some of the research we've done for that to talk a little bit about the kind of efforts that are needed to communicate successfully with our partners. So we know that our partners, we want to involve them in planning processes, and that can be hampered by our ability to provide suitable guidance for them. We carried out a multilingual study last year for the education and the child protection cluster, and we found that there were lots of barriers for local practitioners and partners in assessing and understanding both local guidance and global guidance. And while the research was done in education, I really think a lot of the same learning applies in the work around PSEA. So we looked at DRC, Mozambique, and Bangladesh. And in both surveys and focus groups, partners, and that was including government staff partners and NGO partners, all expressed difficulty in physically accessing the guidance that we were able, that the sector was trying to get to them. Oh, sorry, I seem to, okay, sorry. Jumping around in slides. But there was also a lot to learn about what prevented them from understanding or engaging with the context. A lot of the material was just not in their preferred language, and their preferred languages were much more diverse than the sectors were currently catering for. A lot of the material that they were being given, they felt wasn't being localized enough, and so it didn't feel completely relevant to them. The written and the presentation style of guidance wasn't helping them understand it. There were long sentences and difficult words and very dense text, which was making it a real challenge for partners to understand the guidance that they were being given. And then there were some basic issues around legibility. For example, the font size, the colors of background, the colors in the background and the contrast were real challenges for people, which I think a lot of people producing guidance hadn't really recognized. But there was one really crucial point that I think to some extent surprised us while we were doing the research as much as as a new finding, although we had understood that there was a kind of, I guess we'd understood some of the needs behind it, is that many of the people who were receiving guidance on how to manage education programming, but let us also assume that this is true of guidance being applied on PSEA, were struggling to take a document written in a dominant language, Portuguese or English, for example, and then interpret it into local languages to discuss it with the people they needed to discuss it with in the community. So that gap was really, really important. And they were saying that what they needed was the key concepts being to describe to them incredibly clearly in very succinct way, so that they could then make that transition to to the multiple languages in which they were working, and translating some of those key concepts, not necessarily absolutely everything, but some of those key pieces were really crucial. The other way in which we can really begin to address communication is to start talking about how people receive information and what are the best ways about getting information to people. And I'm going to spend a little bit of time talking now about format. So, safe and accessible complaints mechanisms that can handle SEA complaints are a priority of ISAC and the ultimate responsibility of humanitarian coordinator under the accountability to affected populations and PSEA commitments when we're looking at the humanitarian sector. But making them really accessible is a tough challenge. Camp residents and humanitarians interviewed by TWB at displacement sites in Mongono in Nigeria reported that feedback mechanisms were not accessible to everyone, and this was linked to both language and literacy. So this comes back to, again, how language is being addressed by humanitarian actors. Most humanitarian workers deployed in Mongono in that particular instance spoke Hausa, That's not their fault, of course. It was due to the assumption by the humanitarian organizations that Hausa was going to be understood by everybody. But many people don't have the confidence in Hausa to make a complaint or to discuss a concern in that language. And this disproportionately affects women, who many women said that they felt more stressed and less confident when they were speaking with humanitarian field workers who only spoke Hausa. The alternative feedback mechanism is a complaints box, which requires the person to be able to read or write. And looking at our extrapolation for our findings on written comprehension in Mongono, it seems that only about 10% of the sample looking at our feedback would be able to do that. And then even when somebody does give feedback, the same barriers of language and literacy can prevent them from hearing about what action was taken. So completing the communication loop and telling people what has happened to their complaint was not necessarily happening, and that was breaking down faith in the reporting system. So this is obviously, in almost every context, a work in progress. But one of the things to be considered is looking at voice-based solutions. In that case, in Northeast Nigeria, IOM worked with TWB to trial the use of voice recorders in the community as part of the feedback mechanism. And people in that context, people could go and record their comments in their own language in a private booth. That was then translated and transcribed, and the feedback was given back to IOM, and then it was translated and analysed through IOM systems, and then follow-up was given. And initially, that showed that many marginalised speakers, particularly women, felt quite comfortable in sharing their feedback for the first time through the voice recorders. Going back to the Mozambique response, there was a move to voice-based multilingual hotline, and that improved accountability for those who are less literate. Good practice can also include supporting safe shelters, for example, and in-person reporting. But to do that, we need to make sure that the right languages are spoken by the people receiving the reporting, and also to make sure that they get some training in using and understanding sensitive terminology and recognizing local euphemisms. It's obviously really important to use pictorial information where literacy levels are low. You can use images to raise awareness for sexual exploitation and abuse, but you have to be very sure to test them carefully. We've done some work testing images in Northeast Nigeria, and some of them were met with quite a cautious response and some concern from community members. They welcomed the ideas very much, but wanted to see more versions. And there were quite considerable differences of opinion between men and women about what was appropriate to show. Working with a local illustrator, CDAC and Translators Without Borders developed and pre-tested this series of material in Portuguese, Tuabo, Noadu, and Sena for the work in Mozambique. And I'm sure that hopefully those of you who are online will be glad to know that we're working now with IOM and WFP to understand the best channels and to develop a series of highly illustrated products about PSEA, aimed predominantly at guards, cleaners, enumerators, and drivers, and contract staff and partners. So quite a broad audience. And those are under development at the moment and should be launched relatively soon. The next major issue on PSEA is that we're hampered by terminology. If we think about how we use terms to show status and give respect or to hide our embarrassment, then we begin to understand how much terms matter. Let's take an example from the women's world. We just have to think about the words that we might use to discuss menstruation and how we might choose a different word if we speak to our friend or if we speak to a doctor. And then maybe we can think about how we talk to children about bodies and sexual issues. And again, we choose very different words if we talk to adults and if we talk to children. So then you can see quite quickly how the words, the terms that we use become very important indeed. Also, it's quite common to hide our own embarrassment by using a medical term, but that's probably not the best understood one. So even if we're trying very hard in our communications around PSEA to choose well understood terms in the language that we're using to write it in, we do also need to check that translators are making that same choice when they're choosing the words to translate it into. We might be writing quite colloquially, but end up with a translation which is much more formal. Understanding the nuances and the euphemisms has been absolutely crucial. So, for example, if we take, again, going back to the issue of menstruation, for Rohingya girls, for example, when we did some research on it, we ended up giving organizations some recommendations that where they're going to have to make some deliberate choices between the various commonly understood words for menstruation. So one, if they're thinking about adolescent girls, one can essentially mean becoming big, and the other can essentially mean entering the house, implying that girls will then be restricted in their movement and their social interaction. So the words chosen by the humanitarian and development partners matter a lot, because they're saying quite different things about what's going to happen to that young woman. Using the euphemisms is useful and important. For the Rohingya community, for example, the English word for rape has been generally adopted, but a euphemism which translates as forced oppression is considered much less stigmatizing. The words for rape also can be quite gender loaded, and it has been an issue in men being able to report sexual abuse, which has been documented in some really excellent research by the Women's Refugee Commission. Similarly, other concepts can be very hard to translate. Words to describe, I think, issues like marital rape and paedophilia can be very difficult to find in many cultures where, apologies, where, for example, it can be common to marry young. In northeast Nigeria, the word widow can be so stigmatizing in some languages that it is best avoided. And about a quarter of the Hausa speakers that we worked with in one particular survey didn't understand the standard Hausa term for rape. Also, the acronym SEA, meaning sexual abuse and exploitation, has been translated into sea, as in ocean, in some Hausa documents. Class and gender obviously deeply affect the words that we use, and this is something we really need to look out for, and it's not often on people's radar. In our own earliest translations in northeast Nigeria, we worked with many translators from Maiduguri University, and it wasn't until we tested our early translations that we found out that the Hausa was very elegant, but not necessarily so easy for people to understand who had had less access to education. This can also be true when we're looking at quite experienced field work. We've done some work again in Maiduguri where we were working with wash field workers, and a male staff member reported that he thought that women in one area had no idea what sanitary towels were. And his female colleagues burst out laughing and teased him mercilessly, offering him lots and lots of slang words that he'd just never heard before, which women used with each other. So what is the answer to this tricky problem? Well, it's a bit old-fashioned, but one of the answers is glossaries. If you have a look on our website, you'll find lots of multilingual glossaries. But even if there isn't one for the languages that you're using, discussing terminology amongst your PSEA colleagues, with local colleagues, and amongst the PSEA network can be a really, really good way to begin selecting the best, least stigmatizing words and sharing them and using them consistently amongst your network, which will be then reinforcing the clarity of your message. Thinking about terms and sharing them can also build some of the skills of the people who you might be working with as translators and give you more nuance. I'm sure that you'll be excited to hear that IOM in Iraq is working with TWB at the moment to build an online PSEA glossary in Arabic, Badhini, Kurmanji, and Sorani. And the Resource and Support Hub working with us to add French, Swahili, Tigrinya, Oromo, Amharic, Somali, Igbo, Yoruba, Hausa. We're hoping that there may be other people on this line who would like to add further languages to that glossary also, so that we can have one excellent open source multilingual glossary about PSEA and its the associated terms. I'm going to take just a couple of minutes now to talk about the other kind of important issue when it comes to producing good communication materials. I'm sorry, I'm seeing something that's disturbing my screen, but I'm not sure if you're also all seeing it, so I'm just going to move it out of my way. Plain language is something which we consider to be very, very important. But I wanted to highlight it here for you in using this quote from a focus group participant that we met in Beria. who just said so clearly something that we were interested to understand, to express so clearly something which is interesting for us, which is about how we can condense our messages into the clearest possible way of expressing them so that people can get access to information straight away. Plain language is a recognized discipline of writing, which helps the reader to understand quickly and easily and as completely as possible. When you use plain language, you're trying to make your message clear and present it in a very organized way. It favors short sentences and familiar words. And TWB, we have a plain language editing team, and we regularly deliver training on how to write using plain language principles, because we believe it helps all of us, whatever the level of literacy we might have, to reduce our reading effort. Not only this, but obviously the clearer the original document, the stronger your translation is likely to be. Here are two parallel texts of one of the PSEA principles. At TWB, we worked with the IASC team responsible for the principles to create a plain language version, which was easier to understand. We've since translated them into 100 languages, and at the end of the presentation, we can share a link with where you can find them. But the process wasn't without its challenges. We had to consider our choice of words carefully, and for example, after much discussion, sex worker became prostitute, despite the stigma that we know is associated with the word, because it's much more likely to be understood. And in this case, we needed to choose comprehension over the risk of causing offence. Our efforts to create plain language versions of the principle have also identified several areas in the original version where complicated language had unintentionally hidden the meaning. So in fact, different agencies had quite a different understanding about what it really meant. Basically, at TWB, we don't advocate creating a plain language version of something and an original version. We think that all material should be produced in its original form using plain language principles. And that's going to improve the messages and reduce the reading effort for everybody. We should only need to read something once to have understood it. And I certainly know from my experience that I regularly have to read materials multiple times. And at the end of this presentation, I'll give you a link to some plain language guidance that we've produced, which might hopefully help you in this effort. So we've looked at data and planning and resourcing and support for local staff, and some of the implementation challenges and solutions in terms of formats and terminology in plain language. Let's have a look at a little bit about how these various strands can get woven together for success. When TWB arrived in Cox's Bazar in the late end of 2017, we found that the conservative nature of the Rohingya culture and the non-standardized nature of the Rohingya language made it a difficult place for program teams to discuss the nuances of sexual abuse, with both male and female refugees. We also found that refugees' biggest barrier to giving feedback was not knowing where to go, and this was particularly the case for women. But since then, we've provided response-wide language support as part of a common service for the community engagement and accountabilities team in Cox's Bazar. And that's given, and in that time, the proportion of refugees feeling that they have had enough information to make decisions for themselves and their families has hugely increased, so that now the refugees feel much more confident that they know how to make complaints about the aids and services that they receive. Our support has included gathering language data and testing comprehension to understand the extent to which the Rohingya community understood other relevant languages, conducting lots of sociolinguistic research to build a better dialogue around about issues such as gender issues, but also other sensitive topics, and sharing that in the form of a glossary and guidance around which it contains more than 200 gender-related terms, as well as 800 terms from all sorts of other sectors. We've done training for program staff around language pitfalls and around how to manage face-to-face feedback from the Rohingya community who would otherwise be prevented by giving it from language barriers. And of course, we've been translating and analysing the feedback from various partners and consolidating that in some common information system, including the publication What Matters. In collaboration with the PSEA network and with others, we've also developed key messages in relevant language and formats that have been disseminated through various channels in the camps, and produced localized plain language audio training which has been useful for both the Bengali and Rohingya responders to better understand humanitarian commitments and what it means in terms of preventing sexual exploitation and abuse. All of those resources are available on a platform which we'll share at the end. I think it's also important to note that since COVID began and people's access to moving around the camp has become increasingly problematic, and in between, as women have found it more and more difficult to get out to places where they might be able to give feedback. And this is meaning that there is increasing demands on much more localized feedback opportunities so that people don't have to go so far from their houses. And this is something which means that we're going to have to work with the sector yet again to work out how that could be addressed more effectively. So a lot of these situations, there's a real evolution over time, and we find that that something that has worked for a while has changed during the COVID period, and we're having to work with partners to reinvent and to look at new solutions. So moving on to the final part of the sort of program planning cycle, let's imagine that you have gathered data on language. You've done your best to support and resource the full engagement of local partners and staff, and you developed a truly multilingual accountability and SEA reporting mechanism. You obviously want to know how well you've done. You're going to want to gather data on what language reporting was done, what languages reporting was done in, what language survivor support was offered in, and what language was used to support in investigations. You're going to want to understand if some languages were never used and why that was, and what it says about that language group's information about reporting mechanisms, or gaps in trust, or perhaps gaps in services. Knowing what the language gaps are is going to be key to making communication strategy to addressing them. So I'm going to round up by talking about some of the solutions, just to summarize them. Wherever you are, there are some resources around that can help. And here's a bit of a summary. There is census data and online resources which might provide some information to the language spoken in the areas where you work. You'll probably need to collaborate with a network of partners to gather more locally relevant and specific data, particularly if there's been some population displacement or in situations where there may have been a good census, but it's very out of date. If you disaggregate reporting and service use by the primary language spoken by the person accessing services, you're going to be able to start building up a picture of those people who are using services or making reports, and therefore you're going to start understanding who isn't doing. The key PSEA messages are already in 100 languages, so we've probably got some of those covered that are relevant to you. If you need others, please do contact us. At the outset of an emergency, you can also begin a glossary and share it with the PSEA network based on all of the learning that takes place. And this is certainly something we're very happy to help with. You can join us and try and advocate for plain language across the PSEA networks, as well as in humanitarian sector as a whole, at least trying to make every effort to use it in your agency. And then there are several agencies who can support interpreters and translators, and your country is likely to have professional associations of translators or interpreters. They might not have the languages you need, but they might have some of the training that you might be able to build on. We can also offer shorter targeted training on the basics of humanitarian interpreting and multilingual communication, and particularly tailor it to the work around PSEA, either where we're already on the ground or supporting a network to bring us in for particular pieces of work on building capacity of a number of partners in a certain area on certain sets of languages. We work in more than 200 language pairs, and we can work intensively with PSEA networks in multilingual contexts to provide research and guidance on a range of language support services. And these can involve in-depth research into how people talk about sensitive topics such as sexual abuse, but also really practical support around understanding how the reporting mechanism could be modified to make it more multilingual, or to test the comprehension of messages that you've developed for your organization or for a network around PSEA. We're always really happy to discuss support for the whole network and to try and make communication effective. all the way through the presentation, I've been promising you resources. And so at the end here, of course, are some resources. There are lots more, and we couldn't fit them all on a website, but I'm hoping that in the chat, you've been asking for information and resources, and that hopefully the team online have been able to support you by providing some of those directly. I'm now going to finish the sort of formal part of the presentation and see if there have been any interesting questions that have come up, which we could answer perhaps by taking them live through the discussion. I'm going to mute myself for a moment while a colleague finds out what questions there are.
Hi, Alice. We've got lots of questions coming in just now, and some are seeking resources, but I've got one ready for you to field now if you're ready. And for those who have questions but haven't posted them yet, please do feel free to post in the comments, and we'll feed them to Alice. Feed them is maybe a weird way to put it. Alice, you have a question from Robert Basil. Are there best practices of how to test messaging, pictorial information, / communication materials with affected populations, specifically under COVID, where face-to-face interactions with affected communities are minimized?
That's a very good question. COVID has obviously made it so much more difficult than it was to test information and to test comprehension. I think that, you know, the crucial issue is still to try and talk to people from the various categories that you're wanting to reach, and that could be by reading material over, you know, if you physically can't get to people, it can be reading material over the phone. We've certainly been doing some online testing where we've tried to bring people in small groups onto a shared platform and show them material through the screen, which they can then kind of discuss together. It does, you know, it's enormously limiting, particularly that, you know, the harder it is for you to get good connectivity to particular audiences that you're trying to reach. But the way we've approached it is trying to bring people. We did a piece of testing on these visual materials that I mentioned earlier for WFP and IOM, and we brought people together in several different contexts into very small groups and showed the material. So that they could have a look at material that we were designing, looking at wording that we had selected, and be able to discuss it together. So we had, you know, sort of very small focus groups essentially, but did it across a number of different contexts so that we were able to hear the voice of more people. You could also, I guess, you know, try and get it to people, so ask for them to change drawings, for example. You know, there's nothing wrong with sending out a drawing to sort of a small number of people who you know or who you think might be able to give you feedback, and getting them to actually physically change it on the, you know, on the images, for example, if you're trying to change image. And certainly testing wording by, you know, by asking for a number of people to give you comments through reading it out to them online and through WhatsApp messages is kind of some of the approaches we've used. I'm afraid COVID has just made it enormously more difficult. I don't think we have a particularly magic answer for that one.
Okay, one more, and I'm hopping around a bit. One that's just come in. Any examples on sign language or Braille? So even though this might fall more under people with special needs is the question, but Alice, I thought you might have feedback on how we address those groups.
Yes, okay, and this is where I'm going to explain clearly our limitations. We are now working on our first sign language glossary, and so we're new to this, partly because, as somebody I think has written in the chat, we are also aware that of course there are multiple dialects of sign language, just as there are of spoken language, and we were working at capacity, working with spoken languages. But now we have started taking on sign language, and in 3 contexts, I think it's going to be Mozambique, Sri Lanka, and I'm slightly racking my brain for the third one. We're going to be working on sign language glossaries as well. There's no reason why you can't go through the same process. What we've discovered is that our online glossaries, we are able to add a small like a little GIF, one of these very short, very light films into the glossary so that people can look up a particular word and find the sign for it. And again, I think it's really, really useful when we're talking in a sort of jargon-filled sector and where we want to find a sign which is giving us very precisely a particular term and where we want to check out the connotations. So, you know, just as much as in spoken language, we need to make sure that the sign language, the sign that's being chosen, is a, you know, a non-stigmatizing, accurate, and well understood sign. There's no point having something which is only, you know, a sign so rarely used that it's not going to be understood by the majority of sign language speakers who we're going to be working with. So the same principles apply completely. I'm going to, you know, we have to hold our hands up and say we have not been able to do any work in Braille as yet. It's something that we might look at in the future, and therefore I'm not able to speak to that at all. But we would love to do more sign language work, so please do get in touch with us if it's something that's interesting for you.
Okay, we've got another question about plain language. Thank you for this interesting presentation. Could you please elaborate a little bit more about the difference, if any, between plain language and easy to read language?
Yes, I'm going to try. So the easy read is usually is referring to a type of writing which is usually designed for people with learning disabilities, and it will take quite considerable volumes of information and try and find from within that the one key point that is trying to be made and phrase that as simply as possible. Plain language is a little bit different in that it's not trying to reduce, its aim isn't necessarily to reduce the volume of the printed text on the page. In fact, sometimes the plain language version of something could be even, you know, a little bit longer than the original language. So it's not about necessarily reducing volume, but about making sure that the most important information comes first, and that the information is ordered in a very clear way, and structured in a very clear way, and that we're using a kind of active voice as we write to help people understand it, and that we're making sure that the choices of words we're using are those most familiar to people. So it's aimed, as I was saying previously, it's aimed at everybody, plain language writing, whereas easy read is aimed specifically for people with learning difficulties, as a part of kind of an accessibility tool. It's a slightly, no, not slightly, it is quite a considerably different thing. And for easy read, there are lots of specialists who work into that specifically. Certainly in the major languages, we have probably less resource available to look for those resources in the less served languages. I hope that's clear. There are some good resources around, so if whoever had that question would like to make sure we have their name in the chat, or we can capture them, we can probably find you some resources which help describe that distinction, but also where you can find people who work specifically on easy read. Thank you.
Okay, Alice. This is a comment, but echoed in a few other comments, perhaps. An observation, one of the earliest comments we got during this webinar. I think it is always more expensive to get a good translator than just a cheap own translator. The need to change this mindset is not that easy. So I thought, while maybe there's not a question there specifically, maybe if you could speak to what the process has been, or how you think about that challenge.
Yeah, I think that's a very valid point, and it's certainly a barrier for lots of organisations, both big and small. I particularly where we're talking about underserved languages, it's not that we're necessarily saying that you have to have a professional and fully qualified interpreter or translator. It would be lovely if you could afford it and if it's available. But I think what we are advocating for is that if you're not able to do that, either for whatever reasons, but whether that's a cost or a you know, just their availability, the important thing is to recognize that if you're going to work with, you know, local bilingual colleagues, for example, that they need support to be able to carry out that function, and time to build up their skills in it. That it's not something just by being bilingual doesn't mean that you're necessarily going to be immediately, without any preparation, an impressive interpreter. What people need to be able to do it is understandings of the kind of approaches to interpretation, maybe some time spent thinking about kind of note-taking and how they'll approach difficulties, understanding the differences between being a kind of the different types of interlocutor between speakers. So understanding the kind of interpreter's role as this very neutral space, sort of information conduit between the two. And a lot of the ethics around interpretation. I think particularly people who haven't been very involved, and particularly working on emotional topics, it can be very difficult, I think, to make sure that you've understood all of the kind of emotional, all the ethical issues around, you know, not adding your own opinions into the mixture, and making sure you've understood confidentiality properly. And then, as we were saying, also providing them in advance with some thought through resources, or a good discussion, at least, about the terminologies that you're going to use. So, you know, being able to sit down in advance with an interpreter, if the person you're going to use is, you know, a good speaker of 2 languages, and that's the only person you've got around, and that's, you know, that's the decision you've made, making sure you've dedicated some time in advance to sit down with them, saying, right, you know, these are the topics we're going to talk about. What are going to be the complications of these issues? You know, are there some language kind of pit holes that are going to kind of trip us up in this conversation? Will people have understood this concept, or do we need to find a clearer way of describing it? What would be the best terms? So to try and do that preparation. So we wouldn't necessarily say it's absolutely essential. It's lovely to be able to use professional interpreters and professional translators, but you can perfectly well prepare a strong bilingual speaker, making sure that you put aside both the time resource and the actual resources of materials that will support them in advance. Thank you.
All right, Alice. The next question I'm sending your way is a request for a bit more of an explanation about how it might become problematic if a certain language is not used in investigations. So maybe a little bit more on the impacts of not using certain languages, or using the right language.
Yeah, I mean, I suppose the point of an investigation is to make sure that you've heard everybody really clearly about what they need to say, so that you have the best possible information on which to make decisions, make referrals to support, and, you know, ultimately decide the future of somebody's career potentially. So to be able to do that, I think it's really important that the key people you need to speak to are able to express themselves in their preferred language. And that's really challenging for organizations, you know, with limited resources and dealing with lots and lots of languages. So making sure at least that the most crucial people sort of giving information to the investigation can do that is vital. And again, I would say making sure that you've prepared properly the interpreters, if you're working through interpreters in that process, is vital. The other thing I would say, and you know, this is probably the next stage perhaps, but is looking about referral to services. Again, it's really important that we've understood what is the primary language spoken by the survivor of the sexual abuse or exploitation, so that when we refer them to a service, we're referring them to a service which speaks their language for them. There's, you know, it's so obvious, and I know that nobody would intend to do it, but, you know, it doesn't make any sense to refer somebody for some counselling service in a language, you know, to a service provider which doesn't have their language available. So, and yet that kind of systematic kind of gathering of what, what's your primary language and what languages are spoken by this service provider doesn't routinely happen. It is, it's quite uncommon to take place actually. So both through the investigation process, just to make sure that people are really able to explain the experiences they had and how it made them feel, is really, really vital. And then to make sure that the ongoing sort of referral process also picks up language. I'm just going to give one example. This is actually picked up again from the Rohingya response and in the health service, but you can see how it would apply, is that, for example, the Rohingya women, when they were in our research that we did there, when they were speaking to health staff, referred to their breasts as chest. So they would say, my chest is hurting me. Now, to have somebody say, if you're talking about a sexual assault, it might be quite important to understand that it was a breast that was being touched rather than something a little bit more abstract or a larger area of a chest. So I think it might be really important to be able to help people make that distinction. And those are the kind of things that a good interpreter would need to be kind of thinking about before they go into a session, and which a good investigator should be trying to be quite precise with people so that they're making sure they're getting that the third person's really able to express themselves, and that if they're using a euphemism like that, the interpreter has properly understood it for what it meant, so that the investigator actually understands what it is that's that's being said. Thank you.
Okay, I'm not sure, Alice, if you'll be able to answer, but there's a follow-up question about Mozambique, about the Cabo Delgado response, considering, besides the multilingual hotline, what other reporting platforms are available in Cabo Delgado? Response, considering 80% of women are illiterate, and how is confidentiality maintained?
Oh, I'm really sorry. I don't think I'm going to be able to address that question at all.
All right. Yes, and for those asking questions in the comments, I'm choosing some more general or less specific, context-specific questions, but trying to get to all of them. One question about trying to produce an awareness-raising material for children in schools about SEA. Any tips and advice on the use of language there?
I think the tips and advice would be more or less the same at school level as it would be for adults, except that you might want to go through a sort of slightly double-phased approach. So where you're thinking about the words that people would, the words that you want to use in your materials, it might be worth talking them through with a group of parents first, to ask them, how do you talk to your child of this age about those things? What are the words that you would use? And try and get from them the words that they use and understand before testing them out with children. So just so that you're not making kind of assumptions about the words that people would use. I think work around children's terminology is really, really interesting. And if there's anybody kind of who's, either the person who asked that question or anyone else who's interested in thinking that through, we've got some real interest in thinking through the terms, how different it is communicating with children than adults. But essentially the process is about making sure that you go in with something that's been discussed with the appropriate adults first, and then testing it out with children. And you can always start from the other end and say to children, what word would you use to describe this, and what word would you use to describe that? But you just need to make sure that the questions that you've asked have been tested out with parents and child protection specialists first, I would say. Thank you for the question.
Okay, the next question I can tab over is, do you have any sort of mitigation strategies to avoid a recording booth stigmatizing SEA survivors?
Yeah, this is one which I think is being debated very broadly amongst lots of responses, which is it better to separate SEA reporting from general feedback mechanisms, or is it better to stick them together? And I'm sure, as in many things, there isn't a right and a wrong answer, but I think there has been a general effort to try and combine reporting mechanisms so that people are less stigmatized, so that it's the same place where you go and say, I don't know, the water wasn't delivered, or we're still waiting for the signboard to be put up, is the same place that you can also go and make an SEA complaint, so that it's somewhere where people don't feel stigma to have gone into, and that it's well understood to be somewhere where you could have gone in for all sorts of all manner of things, both trivial or serious. I know that won't work in every context, and I wonder perhaps whether IOM Alex, who's online, may have something else to say about that one. Alex, would you like to add anything on that?
Certainly, thank you. I think it has been a need to balance over the years. I think wholeheartedly we can say that we want to do anything that will avoid stigmatization, and that usually means not having SEA-specific reporting channels. We want to avoid the situation where somebody goes to make a report and immediately can become affiliated with this form of abuse for obvious reasons. So that typically does mean working off of existing reporting channels. So you're working off your CCCM intake, your safe spaces where you have trained service providers that build those trusted relationships. You have an AAP hotline or a CCE hotline. That in turn then means that it can be the PSEA stakeholders' role to work with each of those channel operators, the people who are running the info desks, to make sure that everybody who's operating those understands how to recognize SEA and where to send the allegation. So it's kind of a challenge. Do you have a special SEA reporting line where you know that everybody who's working it knows how to respond? Or do you avoid stigma by building off of existing channels, but with the knowledge that not everybody who runs those channels has the systems in place to handle the allegation? So that is the balancing act that we're working under, but I think it's a matter of engaging with those communication with communities, colleagues, the colleagues that are running the complaint intake channels, and especially working with your GBV, child protection and protection specialists, to make sure that every step of the way is not endangering potential complainants. Over.
Thank you, Alex.
Thank you. Okay, and then we've got one that just came in, which is a bit of a comment, but perhaps Alice, you'll have a response. Is this about communicating in the low literacy with people with low literacy? It worked well in Somalia to make use of local artists, coming up with some drawings to depict gender roles in Somalia context. This helped in communicating and enhancing understanding of participants with low literacy, and this can be replicated in PSEA-related communication when subjects have low literacy levels. Maybe this might be interesting to address. What's the word I'm looking for, Alice? The
localization aspect of it, perhaps.
Yes, thanks.
Thank you. Yes, very good point for whoever raised that. So yes, indeed, I think having local artists and in making it a process, sort of with designs being developed in country and in the particular community with which you're working, and then having people working with, essentially workshopping the designs with the group that you're aiming the visual material at, is absolutely the optimum process. And if you can do that, the more specific the better. If you're working on materials aimed at adolescents, then working with adolescents with an artist to kind of design it even better. If you're doing so with if you're aiming materials at men, then working with groups of men to do it. I think the more specific the better in terms of working with materials. I think it is worth checking whatever your desired audience. It's definitely worth once you've got the materials designed, working with that particular group to achieve it, doing a slightly broader check for sensitivities. If you've designed some really exciting materials with adolescents, and then it turns out that older residents in that community find them offensive, you may not be able to, you may not get their support and permission to put them up. So you might need to do a little bit of a kind of cross-check across different groups to have made sure that they're appropriate. But I think it's a fabulous idea, and I think where it's, where we've seen it done, it's worked really, really successfully. So I would definitely encourage pictorial communication.
Okay. And before I forget, Alice, we have a question. How can people, how can organizations engage CLEAR here it is, how to proceed to seek any field support from TWB?
Okay, yes, I think write to us or to our website. So you can either do a translation request onto our website, and that would kind of trigger our partnerships team to get in touch with you and arrange a phone call to talk through what kind of what sort of services you need, or feel free to contact one of us directly. And when I send out this presentation, we will of course include our contact details in it as well, so you'll have those and you'll be able to get in touch with us straight away, and we're very happy to look forward to it, of course.
Great. I think we've run out of time on Q&A, if I'm right. But Alice, what can people do if they have further questions after this? I know we've not quite reached every question on the list.
Yes, I mean, as I said, we'll be sending out this presentation, and with it we'll be putting Alex's details, who's the IOM colleague who has set this up and has, would be able to answer many questions around sort of reporting best practices, and also our details, so that if you have particular language questions or you want to do kind of more involved work, more in-depth work on language, so then you'll be able to get in touch with us directly. So both of those will be sent out along with the presentation and the kind of key points from the chat at the end of the webinar. That's the word I'm searching for. At the end of the webinar, but it'll probably take us a few days to get that organized, but it will come out to you very shortly. So thank you, Alex, very much for managing the questions. And I think then it's probably back to Alex, IOM Alex, passing from between Alexes, if that's it on questions.
I love it. It's not just between Alexes, it's Alex H in both TWB and IOM. That's fabulous. Thank you so much, everybody on this call, for your really in-depth questions that let us really get into the specifics of this. What I love about working with TWB is these webinars are so practical, and they really do have all of these resources and examples to share. So thank you, Alice. Thank you to the TWB team. I would like to reiterate Alice's call earlier for glossary inputs, and just generally anybody who is on this call and has examples of how you have experience in either measuring language needs under assessments, language on how your organization or network assessed and addressed challenges in accessibility. If you can share those, I mean, we're at a point right now where we are defining the roles and responsibilities of PSEA focal points and networks, where we can put this all into guidance that everybody can learn from. So if you have examples to share, you'll have all of our contact information when we circulate the presentations and the recording from this. And again, everybody who is registered, so everybody on this call right now, will receive the recording and presentation. And the more we can hear from you, the more we can improve our global guidance. So thank you very much once again to TWB. This has been a great pleasure. And I wish everybody a good evening or rest of day wherever you are. Thank you.